The NHS is an enormous organisation. It has huge and complex challenges. The truth is, we need a shift. We need to move care from an acute environment into a community environment. We can't just keep fixing people who are ill. We've got to invest in keeping people healthy. Property is integral to that investment. You've got to provide the quality space, and you've got to provide good accommodation for people to want to live in who want to work for the NHS. Prime is a property developer specialising in health and care. We support the entire health and care system to provide the facilities that they require. Prime sources the sites, we buy the site, we employ the design team, we coordinate the design process, we get planning consent, employ the building contractor, we raise the finance, and we make sure the building is delivered to everybody's requirements and specifications. And crucially, we can raise hundreds and hundreds of millions of pounds for projects. And here we are today in one of those community healthcare facilities in the making that are so important in that shift in keeping people healthy. It is a specialist cancer facility which you would normally only find within an acute environment.
The overall approach of this building is much different than an institutional hospital. It's much more inviting, a much less intimidating space for patients to come and receive their cancer treatment. When we designed the centre, we had a multi-storey car park to the rear of the site. We then positioned the cancer centre along the back of the site with the radiotherapy bunkers to the rear of the building. This in turn then allowed us to put well-being and consulting spaces to the front, which then allowed us to present views to the patients out from the building. We worked with a landscape architect to develop the site. We created a well-being garden where patients had a relationship from the reception area out onto the well-being space outside. Overall, we wanted to create a building which was comfortable, welcoming and accessible. And I think we succeeded with that.
Although this building has been paid for using private capital and it's run by a private provider, when this community facility opens in a few months' time, it will still also provide care for NHS patients. So from an NHS perspective, this meant that they were able to access a facility like this, that they can treat their patients in collaboration with a private provider, but they didn't have to raise the money. They didn't have to go through the approval processes in order to get authority to do the work. And this is a perfect example of how the NHS and the private sector can work in collaboration and partnership to provide some of the capacity we so dearly need. We build everything that's associated with health and care. So that's hospitals, community care, elderly care, and key worker accommodation. We have built 130 plus health facilities across the whole spectrum of health, and that knowledge of how the NHS works and the complexity of the NHS, we understand that, and that's why clients come to us, because they know that when they talk to us, we understand their problem.
One of the biggest challenges that the NHS is facing is the recruitment and retention of staff. One of the challenges is the availability of good quality, affordable key worker accommodation. Over the last few years, Prime has been developing a model to deliver at pace, sustainable, affordable key worker accommodation. And Alexandra House in Dorchester is a great example of that. Alexandra House is a 10-minute walk from the hospital. There's no lengthy commutes, no expensive commutes. We offer a fully managed service, so if there is a problem with their apartment, we organise for somebody to come and fix that problem. Sometimes the tenants need flexibility in their agreements with us, so we are happy to offer short-term lease agreements for those people where their skills might take them from hospital to hospital. What we found at Alexandra House is that the first cohort of tenants have actually been international nurses. It's probably the first time they've been to the UK, and certainly the first time that they will have rented accommodation here. And imagine what that must feel like when you're coming to a whole new country and you can't even find somewhere to live. We help those tenants understand what it is to rent in the UK housing market, and we provide additional support in helping them set up their bills, helping them understand council tax, so that they can concentrate on their patients from day one.
I'm a radiographer. I work at Dorset County Hospital. I moved with my family to the UK about a year and a half ago. I have a family of 4. It's a beautiful building. It's lovely. It's a nice place to make a home. This is my home. It's a 2-bedroom flat. It's very spacious, and it's a very nice place to be. I was having a difficult rental situation. I talked to my line manager at Dorset County Hospital, and she informed me about this building that's available for key workers. I was happy to have the opportunity to get to move into this building, and it has been great since then. Houses around here are quite expensive, but this is quite affordable, and for the fact that it comes furnished and ready to live in is awesome. Hive is the operator of the building. They're a really nice landlord to deal with. Repairs, once reported to Fixed Flow, are attended to as soon as possible. They are always nice in communicating with the tenants around, so it's been wonderful. A key worker accommodation like Alexandra House will make recruitment for NHS much easier, because once you're confident that you're going to have a place to live in, especially if you're coming in with family, it gives you that peace of mind that you're well prepared for, and you'll be comfortable to come in and work as a key worker in the NHS.
Prime has been working with the NHS for over 25 years. We understand their needs, we understand the complexities that they face. We are best placed to support them with property solutions to help them with their real challenges, because happy NHS workers results in better care.
The good news is that the NHS has got a huge estate, and we can help them make the most of that estate. They also have a huge capability and expertise. We can supplement that and bring our experience and know-how to the table too. And together, I think we can meet the challenges of the present and also of the future.